Can you tell us the differences in the surgical approaches to total hip replacement?
Sure, that's actually probably one of the most common questions I get too in the office. There are a lot of approaches. Oftentimes patients will come in asking me just about one or two approaches and comparing them, but there are a lot of them. Most commonly, there are probably three approaches I get questions about, and those approaches would be a posterior approach, or sometimes people will say the hip being done from the back, a direct anterior approach, or the surgery being done from the front. Then the third type sometimes would be an anterolateral approach, where the hip is kind of done from the front, but slightly different from a direct anterior approach. And like I said, there are many other approaches out there, and also variations of those three. By far the most common question I get is people asking about the hip being done either from a posterior approach or a direct anterior approach. And the most important thing I think about hip replacement surgery is that regardless of the approach, the results are excellent. Probably one of the most, if not the most, successful surgeries ever invented. And so that's the most important thing, is focusing on all approaches can achieve really good results. That being said, there are definitely pros and cons to the different approaches, and this is something that is very hotly debated in the community of joint replacement surgeons like myself. I personally use a direct anterior approach for most of my hip replacement surgeries. There have been some benefits in the literature shown, such as a faster recovery and possibly less risk of instability. But again, those are things that are debated in the literature and elsewhere. And so I think the most important thing to focus on is that all approaches do well and patients do well, and different surgeons will have different reasons for using the approach that they choose.